most especially in their 3rd month. It normally expresses itself in their 3rd month. Then for the case of pox, like I said before, the basic treatment or supportive, let me not call it treatment because they are very infections, but call it supportive treatment, is that you first vaccinate those birds even when they are sick. Get the vaccine for pox, vaccinate them, then after which introduce high doses of oxytetracyclines, like I gave you the 2 examples of limoxicines, and give them starting from the 2nd day after vaccination. You give them for 7 consecutive days. When I talk of consecutive, I mean day and night. Then for the case of fowl typhoid, in case you missed to vaccinate it and there is an outbreak, or when there is an outbreak even before vaccination, kindly get a drug that contains enirofloxacin. A case in point is enirocure, enirovate, enirosol, and fluoxetine. But the best would be fluoxetine because it is 200 milligrams or 20%. Then apply high doses like 20 mils in 20 liters for 10 days. When you finish the treatment, the 2nd day after fishing, I mean the 11th day after finishing the treatment, kind of vaccinate them against that fowl typhoid. That's all about the vaccinatable diseases. But for the case of mycoplasmosis, being a bacterial infection as well as a vaccinatable disease, in case you exhibit that outbreak, you may resort to first treat with any antibiotic that contains both vitamins and oxytetracycline, like oxyvitamin, oxytetravate, and all the like. If they are mature and there are no combined drugs that contain those 2 drugs in high ratios, you may resort to mixing manually, getting the limoxicin 40% or 100% and mixing it with any plain vitamins. With mycoplasmosis, it is only seen when you see that the bird are exhibiting poor inhalation or dyspnea, not easily inhaling air, drooling from the nose, as in there is some mucus discharge from the nose, and the head has swollen, the whole head, the facial has swollen totally. There you resort to doing so. Then for the case of infectious coryza, with infectious coryza, the cardinal sign you would see would be swollen, either unilateral or bilateral swelling of the eye, bilateral ocular swelling or unilateral ocular swelling, where when you squeeze that eye, you see a cheesy whitish material coming out of that eye. There you suspect infectious coryza. The best treatment would be ESB3 or erythrolate 35, after which you vaccinate against the same disease. Then I didn't give you some of the cardinal signs for the previous diseases. For the case of Newcastle, you would see a greenish diarrhea or discharge. Then you would see coughing and some respiratory errors, but even other birds can exhibit coughing. Other diseases can also exhibit coughing. A case in point is mycoplasmosis, infectious coryza, infectious bronchitis, even helminthiasis, or the birds being affected by the worms, most especially the gape worm. Yeah, the one that normally attacks birds, most especially in the upper GIT, in this region of the trachea. Then in other signs of Newcastle, the birds tend to exhibit torticollis, especially in chronic Newcastle. They turn their necks upwards, they somersault, and they can move backwards. Then, for the case of IB or infectious bronchitis, I talked about Newcastle infectious bronchitis, gumboro. With the gumboro, the birds, I talked about them feeling so cold, they are slow to move. You see whitish diarrhea, that is paste at the vent, and sticks at the vent. Then the birds are unable to eat, are unable to walk, are unable to drink. Within no time, they start dying at the highest speed, and you may lose the whole flock if you don't do the supportive treatment as early as 1 hour the first time you see that first case. Then for the case of the rest I've explained. Then besides those vaccinatable diseases, other diseases include coccidiosis. This one, we have both sickle and intestinal coccidiosis. With sickle coccidiosis, it normally affects the cecum, and it is more of white diarrhea, not paste like in gumboro, not sticking like in gumboro, but just white diarrhea. And those birds also droop their wings. They become unthrifty. They are unable to eat. As in, there is a drop in eating, but it does not kill as fast as the gumboro.